Dear viewers, subscribers, budding nursing and paramedical professionals, Assalamu alaikum warahmatullah. Welcome back to our own channel, Advanced Nursing Theory and Practice. Today we are back again with the subject of nursing foundation, and today's topic for discussion is regulatory bodies in nursing. And under this heading, we are going to discuss Indian Nursing Council, and this will be the part first of this series. This topic will be covered by me. Now, what are the regulatory bodies in nursing? A regulatory body is a professional body that does not primarily issue membership to its members. However, its activity is to safeguard the interests of general public or people and professional members as well. It is established on the basis of legal mandate, and this legal mandate is provided to them by government. Regulatory bodies exercise regulatory function, that is imposing requirements, restrictions and conditions, set standards in relation to any activity, and secure compliance or enforcement of said circulars, orders, notices and rules. There are two regulatory bodies in nursing. Number first is Indian Nursing Council and number next is State Nursing Council. Now Indian Nursing Council is a statutory body constituted under Indian Nursing Council Act 1947 and was established in 1949. The main aim, or we can say responsibility, of this organization is regulation and maintenance of uniform standards of training for nurses, midwives, NMS, and health visitors. Now, what are the functions of INC? Number first function is to establish and monitor a uniform standard of nursing for nurses, midwives, NMs, and health visitors by doing inspections of institutions or colleges or paramedical institutions or nursing institutions, we can say. Number next is to recognize the qualification for the purpose of registration. That means INC has to recognize ANM program, GNM program of various institutions and employment in India and abroad, and after issuing registration they can get employment in India or anywhere at the global level. Number next is to give approval for registration of Indian and foreign nurses possessing foreign qualification. If anybody has done his or her masters or bachelors from any other countries, it is the duty of INC to issue equivalent certificates. Number next is to prescribe the syllabus and regulation for nursing programs. Number next is establishment of nurses registration and tracking system for nurses in India, whereby INC has to grant unique ID to each and every nurse. Then they have to provide compulsory continuing nursing education programs to them and grant lessons for 5 years. Number next is ability of or we can say power of INC to withdraw the recognition of qualification standards that an institution recognized by a state council for the training of nurses, midwives, NMs or health visitors does not satisfy the requirement of council. If there is inadequate infrastructure or tutor student ratio or inadequate lab facilities, then college or an institution can be derecognized by INC. Number next is to advise the state nursing council, state governments, central governments, examination boards regarding various important issues pertaining to nursing education or service. Number next, we must know who are the members of INC. Number first is the state nursing registration councils, then central and state health departments, military nursing services, Indian Red Cross, then health schools, then Trained Nurses Association of India, then Medical Council of India, Indian Medical Association, and members of Parliament. Now, what is the organization of INC? INC is presided by president, having a vice president, secretary, assistant secretary, and official staff. Now, what are the various programs run under INC? These are ANM, GNM, post basic BSc nursing, then BSc nursing, MSc nursing, MPhil nursing, doctorate in nursing, then postgraduate nurse practitioner in critical care, and other diploma and practitioner courses. Now, what are the various types of inspection that INC conducts? These are first inspection, then re-inspection, and periodic inspection. First inspection is done at the time of establishment of college, where it is given approval to conduct on preliminary basis or provisional basis. Number second is re-inspection to check whether college has improved are provided adequate facilities or not, and periodic inspection is to check whether quality is maintained or not. These were the types of inspection, and this was all about the topic of INC. Thank you very much for being with us. Do not forget to share, subscribe, and support your own channel. Your suggestions and valuable comments are welcome at these email addresses. Thank you.